Hi, I'm Subina Surendran. I'm the Director of Life Sciences Partnerships at Holmusk. Holmusk is a real-world data and analytics company based out of Singapore, focusing on mental health and chronic diseases. We have presence globally. We have an office in Shanghai, in Malaysia, in the US, in New York and North Carolina, as well as in the UK.
COVID has, not only for mental health patients, but also for the general public, created a really unique setting in terms of social lockdown, self-isolation and quarantining, which has itself caused increases in anxiety and stress and mood problems for any member of the general public, as well as potentially exacerbating those already with severe mental health conditions. There's so much attention placed on the public health point of view, the infectious disease point of view, that there's lack of attention placed on chronic disease, including the mental health space.
I think with the pandemic, resilience has really become a key issue. So resilience has always been there, and it's always been something that that has existed in the mental health space. But I think because of this pandemic and because of the shared experience of stress and uncertainty, there's a lot more emphasis on being able to adapt and bounce back from that.
Hello, Paul Feldhausen, Director of Strategic Partnerships at Holmusk. Holmusk, being a global company, we're uniquely positioned to kind of see the impact of COVID and recognize a pattern where it's not just our Singapore clients or our US clients who are reaching out to us, but it's also our UK clients. We are entering into partnerships in China. This is not a localized effect. This is very much a globalized effect, and it's the same themes across the globe.
And the sheer unmet need in this area is too large, and the burden of disease is too large. And there is a real rush towards building solutions, and most importantly, digital solutions, by which this can be tackled.
We've been looking at some of our data. So at Holmusk, we're very into real-world data and real-world evidence. We're looking to build what we claim is one of the largest real-world evidence platforms, particularly for mental health and behavioral health conditions. And this video has been interesting because we've had to go in and look at our EHR records and look at our kind of digital health records, and it became even more prominent the need to have better data lakes, pooling of data, data partnerships to be able to look at this data in a real-time setting. COVID has allowed a huge opportunity or a great emphasis to understand the need for that real-time data around specific conditions, and the power that data would have to be able to direct services, to direct reimbursements on some of these services, which otherwise would never have been talked about.
I would say in the mental health space, given that there are a lot of challenges with regard to quantitative measures, there's a lack of a large real-world data set that can be leveraged for research and development, both into new drugs, but also sort of the effectiveness of current treatments and treatment protocols. Real-world data can definitely help in that standpoint.
I think prior to the pandemic, in lots of healthcare settings, we still relied on traditional methods of data collection, utilizing mainly, the consultation and the clinician-written electronic medical records to direct diagnosis and management of patient care, not just for mental health and chronic disease, but for any condition, really. And with COVID, we've seen that sometimes that's just not possible. You're not able to have that patient-clinician interaction with lack of clinicians on the front line, with moving of resources and so on. And so there's been both kind of a push and a pull towards patient-generated data and real-world evidence data collection.
So one way that Holmusk is addressing this is seeing how we can better integrate patient-facing solutions with sort of hospital systems so that there is a feedback loop back to the clinic. So it acts as both a remote monitoring solution, but also as a rich data source for clinicians to better monitor how patients' treatment journey progresses, and then use that to make decisions around their care. With regard to real-world data, psychiatry data is a little bit more unique than other disease areas in that you are more reliant on notes and sort of, I would say, questionnaires to determine the status of a patient. So you're not as reliant on blood or lab results that might be much more quantitative and objective measures. So the way Holmusk has been sort of addressing some of the challenges with regard to psychiatry data is that, we've developed NLP algorithms to process the clinician notes and then sort of essentially be able to quantify a lot of measures within mental health in a more quantifiable manner directly from the clinician notes. Also from a patient-reported outcomes, we are using clinically validated PROs that can be leveraged to better understand how patients are, the severity of their symptoms or their side effects or their function on day-to-day lives.
Most of our clients have started asking about two particular things. What are the solutions that we have in terms of our analytics horsepower for evidence generation, as well as what we can do in terms of building digital solutions which can be deployed to a wider intersection of population to serve this area.
We've had clients who are now talking to us around incorporating certain of these mental health and mental well-being aspects into their delivery for their employees and the care providers who are on the front lines. So what we've seen is actually just a really concerted shift forward for a lot of our initiatives of greater awareness and a greater want to and need to bring solutions around mental health and mental well-being to our clients. In addition to that, bringing assessments not just to understand mental health, but more mental well-being around resilience. This has become a very clear factor and concern for our clients.
So I think with the assessment, something that we've tried to integrate into it, which wouldn't have been as prominent in a regular mental health assessment, is really kind of assessing whether somebody is able to bounce back from stress and anxiety. Because I think with a lot of mental health assessments, typically you tend to look at a lot of the behaviors and feelings and thinking that kind of comes with like the stress and anxiety, but you don't tend to look at the positive psychology end of things where you think about how am I going to come back from that. And I think the thing about having a pandemic being such a large collective experience is that people start to think about really trying to make that work and being able to come back to, I guess, status quo.
We need to make sure that there's sustained focus on chronic conditions so that, whether in the future we come across another acute medical crisis globally, or whether we just need to manage chronic conditions in the context of an aging population where demand is also always going to be growing, then digital solutions are really the way forward.
It's not just about one digital therapeutic or one platform winning. We all need to win. We need to have multiple winners. And when you talk about mental health, mental well-being, this is not a zero-sum game. We need everyone to rise up, to partner, and to participate in this process, whether that's through data partnerships, whether that's through sharing of information, whether it's collaborating on research like we're doing here today. This is not a time for us to be holding our resources and our know-how inside, but to be sharing that. And so at Holmusk, we're happy to participate in this and move these initiatives forward.